Can you tell us why are you particularly involved in this campaign, Safe Hospital from Disasters?
Probably because I'm the head of the Social Welfare Department in the Aga Khan Development Network, which means that I head a department which is directly responsible for the operation and management of 200 health centres, 12 hospitals and over 300 schools.
Okay. How the Aga Khan Network Development is going to support and sustain this campaign?
Well, I think we have been applying what one could term best practice for many years now, many decades actually. Our institutions are built to code +2, so they're all seismically resistant and fitted for the local area where they are. Also, we have been building in the community and in our institutions an ability to respond, to be prepared to and respond to disasters. And in that sense, I suppose promulgating this message is something that we can do with the ADG, that it's not just the hospitals have to be resistant to disasters, but also the personnel has to be trained, and the community around the hospitals and the institutions needs to be trained as well. There must be access to clean water supplies, emergency supplies, also telecommunications and transport.
I would like to know why a development agency like yours is supporting this new campaign on hospitals safe from disasters.
I mean, prevention is something extremely important, but hardly anybody is going to invest in prevention. We have to turn the issue that you analyze disasters and you respond to disaster. It's much better to prevent them.
Are you going to work on specific countries with this campaign?
Yeah, we are working there where the disaster response or where rebuilding has to be done after wars, but we are ourselves in development cooperation active in the health sector in a number of countries, like in Cambodia, like in India, like in Afghanistan, like in Pakistan, Benin, Mali. So quite in a number of countries.
And could you tell me, for example, what are you doing precisely in Pakistan?
Yeah, especially in the northern areas in Pakistan, it is very important to see what building standards are used to rebuild or to, let's say, make the hospital safer. So it is always a matter, what can you do with the existing infrastructure to prevent losses or to prevent major damages during disasters, and what you have to take into account when you build new hospitals.
Why hospital safety is such a priority in disaster risk reduction?
I think for two main reasons. Firstly, I think hospitals are very important in the life of any community, and they're a massive investment that governments and local authorities make for the good of their communities. So preserving them in disasters from every point of view has got to be one of the big priorities, and that's why we've launched this 2-year campaign to put safer hospitals at the heart of all disaster risk reduction efforts. But there's also a more obvious reason, if you like, which is that when a disaster strikes, you need to have a functioning hospital. People are injured, people are in need of help. If your health facilities are knocked out immediately, that removes one of the main pillars of actually trying to respond to the disaster, and makes it much more complicated. And I think it's also a very negative factor in a disaster if people see that the thing they rely on most when they're in that kind of need has been itself destroyed. It's a very important thing for morale and for the whole image of the disaster. So that's one of the reasons I think it's so important. And I think it can be done. It doesn't cost a fortune to insulate your hospitals against disaster, against earthquake or against flooding. Maybe 4% of the cost when you're building it. That's a pretty good investment by any standards, and that's why we're going to press that so hard.
Why, or how do you see, what are the main challenges in this campaign to implement it and to achieve the objective of the campaign?
I think the biggest challenge in a way is to persuade governments and local authorities to put the resources into this. People will accept this in theory, and we all know in our own personal lives, as in public life, that prevention is much better than cure. But we also know from our personal lives that we don't actually abide by that maxim. We actually wait for something to happen and then we try and respond to it rather than taking the precautions and the measures that we could take in advance. So persuading governments, and we're talking here about countries and governments which don't have many resources. They are short of money for everything. So persuading them to put the money into this as opposed to something else, as opposed to thinking, well, let's build lots of cheap hospitals rather than lots of safer hospitals, that's a big challenge which will take a lot of effort working with finance ministers, working with health ministers, working with those who are actually responsible for disaster management. I think it can be done, but it's going to be an uphill struggle, and we're going to have to put a lot of effort into it.
So why WHO is supporting this new campaign?
Well, it's because it's becoming an increasingly important area of work for WHO, and because the World Health Assembly and member states are asking WHO to work more intensively here, because WHO wants to protect patients, health professionals, and also the public from disasters and crises, and because also WHO would like to ensure that health facilities continue to function well during crisis, and this is exactly where and when health services are most needed.
How concretely WHO is going to support the campaign? I mean, what sort of action are you going to take?
WHO is the key partner with ISDR in the Safe Hospitals campaign. We are working very closely with ISDR on issues related to advocacy, increasing the awareness about the importance of taking concrete action to ensure that hospitals are safe during disasters. But we are also working closely with ISDR on developing technical guidance on a number of issues related to improving the safety of hospitals. And when we say hospitals, we're actually talking about other health facilities. We're talking about health centers, laboratories, we're talking about medical warehouses and other kinds of healthcare facilities.
It is clear that we're going to need to be more skilled and more alert to reducing and mitigating and having disaster preparedness, as we've heard, because of the already felt impacts of climate change. What I would like to see happening from this launch is that the specific way in which there has been a preparation for this launch, that there has been a mapping, that there has been a securing of buildings, looking at hospitals in different regions, as we've heard, becomes itself a valuable lesson to the way in which we must break down the various components of the wider adaptation and very much emphasise the importance of disaster preparedness, mitigation, reduction, and starting in key areas that prioritise, as we should, right to health and the infrastructure to secure health even when disasters occur.